Welcome to the Counselor's Soapbox video channel. In today's episode, we'll talk about stimulant drugs. While some stimulants are used, many are abused. In this video, we will talk about the principally abused stimulants: cocaine, amphetamines, and its newer relative, methamphetamine, and some related compounds. Stimulant drugs have both legitimate medical uses and abuse potential. Cocaine is probably the most widely known. Second is amphetamine, which can include Adderall, dexedrine, and a number of other related compounds. Many people are aware of methylphenidate, Ritalin, and its medical uses. Recently, we've seen an epidemic of methamphetamine use and abuse. A new entry in this area is methcathinone and related compounds, sometimes referred to as bath salts, herbal incense, or water pipe cleaner, a lot of labels. We also need to take a little bit of a look at caffeine, as increasingly we are seeing problems with the overdose and abuse of caffeine. Most stimulants are either scheduled on Schedule 1 or Schedule 2. If you're not familiar with drug scheduling, you might want to take a look at a previous video about the history of drug use in America. Those drugs on Schedule 1 should not be prescribed by any doctor in the United States, and those on Schedule 2 require a triplicate prescription pad and a DEA number to be prescribed. Stimulants produce feelings of energy, alertness, talkativeness, and some people experience them as providing a sense of well-being. Stimulants produce specific changes in the body. They increase heart rate, increase blood pressure, dilate breathing tubes. They can increase purposeful movement and feelings of euphoria. Some people, while taking stimulants, also experience repetitive motions. There are definitely physical dangers from the use of stimulants. At high doses, stimulant drugs may result in seizures, death, sudden cardiac arrest, stroke, breathing failures, and hyperthermia, or unexplained fevers. Stimulant drugs have significant psychological effects. Users can experience these effects as positive, but there are also psychological dangers. People taking stimulant drugs can experience episodes of hostility, paranoia, delirium, psychotic behavior, and it can result in profound addiction. These effects can be the result of many doses over a long period of time, or can occur as the result of a single high dose. Stimulant drugs can also have some dangerous interactions with other medications and drugs. It should not be used with anything that raises the blood pressure. There can be dangerous interactions with over-the-counter cold medication, with certain types of antidepressants, which enhance the effect of stimulants, and also there can be dangerous interactions with alcohol, which can prolong the amount of time the stimulant drug is in the bloodstream, raising the blood pressure even higher. There have been periodic episodes of stimulant drug use and abuse throughout American history. The first great cocaine epidemic occurred in 1880 when an increase in cocaine consumption had begun. At that time, it was recommended by physicians. It could be purchased over the counter without a prescription. It was also included in patent medicines. In the early days, it was a part of the formula for Coca-Cola, and you could also purchase coca wines. And cocaine was marketed with testimonials from many famous people. Cocaine use subsided significantly after the passage of the Harrison Narcotic Tax Act in 1914, but there was a resurgence of cocaine use the second time in the 1970s. At that point in time, powdered cocaine was expensive and was highly glamorized. It was used by actors and musicians. Snorting of the cocaine constricted blood vessels and slowed the absorption. Later, cocaine began to be freebased using a solvent which was highly flammable. Finally, in about 1986, crack cocaine made a reappearance across the United States. Crack cocaine was made by taking the powder, adding other ingredients, and creating small, smokable rocks of cocaine. This was cheaper, it was easily smokable, it produced a very rapid high, but a very rapid crash. Crack cocaine became very popular in poor and inner city areas, resulting in a number of laws being passed which provided strict penalties and stiff penalties for the use of crack cocaine. Two significant laws were the Anti-Drug Abuse Acts of 1986 and 1988. This was the result of increasing street violence over crack cocaine distribution. Whenever we have an unstable market, particularly for drugs, we can see an increase in gang violence as various sellers of the drug compete to obtain territory. These acts resulted in an increased penalties for crack cocaine, both for sales and possession, although the quantity of crack cocaine that was needed to be arrested and convicted of sales and possession was made extremely small. The early use of amphetamines was largely for medical applications in the 1920s. It was used by both sides during World War II, where it allowed people to stay awake and be vigilant and fight for longer periods of time. After World War II, many people who had used it in the service returned to the United States and continued their use. It was used by long-haul truckers to stay awake, by women to get more work done in the house, and to lose weight. It was spread across the United States, popularized by returning servicemen and the involvement of biker gangs and truckers, as well as being prescribed frequently by weight loss doctors. In mental health, all amphetamines are diagnosed under a single category, including meth. But in substance abuse treating, methamphetamine is listed separately on forms. This is because the older amphetamines are usually available in pill form, largely by prescription, where the powdered methamphetamine is an illegal street drug and can be both smoked and injected. It became popular on the West Coast in the 1990s, having come from Hawaii, spread rapidly across the West Coast. One of the expressions was that people were dating crystal because of the high prevalence of both smoking and injecting it. It has since spread through the Midwest into the East Coast. Originally, it was largely manufactured in small local labs, which resulted in a lot of toxic pollution. More recently, it has been produced by large super labs, and it is now produced in Mexico and other places and imported into the United States in large quantities. The users began with the bikers and street gangs, but it also has been used prominently as a club drug, commonly used for women for weight loss, and in the gay community. Being injectable and smokable and producing the feelings of pleasure and energy that it does, methamphetamine use is spread to almost every segment of our population. Both cocaine and amphetamine, including methamphetamine, have significant effects on the nervous system. Stimulant drugs block the reuptake of dopamine, norepinephrine, or noradrenaline as it's called in Europe, and serotonin. This can result in dangerously high levels of these three neurotransmitters. For more information about neurotransmitters, watch for another video on the effects of drugs on the nervous system. Amphetamines can also increase the release of both dopamine and norepinephrine, flooding the system with these chemicals, resulting in stimulant psychosis and in long periods of lack of sleep and wakefulness. Methamphetamine, and to some extent pill form amphetamine, have significant health issues. Use of stimulant drugs of this nature can result in seizures, psychosis, largely visual hallucinations, convulsions, cardiovascular collapse, violent behavior. Can also result in hypersexuality, in which people will engage in sexual behaviors they would not have done when they were without the drug in their system. After the meth is used and the person begins to withdraw, extreme depression and meth mouse damage to bones and teeth also occur. Methamphetamine can result in damage to the brain, destruction of the dopamine or pleasure pathways, motor impairment, memory impairment. It's been linked to episodes of Parkinson's disease and can result in pruning of nerve endings. While these nerve endings can regrow, and in my experience, users are still relearning things they used to be able to do over a period of 5 years or more. It's good that they can relearn them, but it's frustrating that people lose so much of their past ability, particularly coordination. The effects of stimulant drugs are heavily dependent on the dose. At low dose, there are behavioral effects, increase in sexual desire, though it can interfere with erectile dysfunction and cause impotence. The picture on the right, by the way, is a new emerging drug called CAT, which is found in the Ethiopia and Somalia area of Africa, and has become popular since the deployment of large numbers of troops to that area. At high doses, the effects of stimulant drugs can be even more significant. Paranoid delusions, stereotypical repetitive behavior, rocking, hair pulling, chain smoking, fiddling with things repeatedly, hallucinations, formication, which is the feeling of having bugs crawling on the skin, and all of these effects can be treated with antipsychotic medication. Some users have done enough damage to their brain through repeated use of stimulant drugs at high doses that they may need to be maintained on antipsychotic meds for a long period of time. The picture on the right is one of the many new, quote, bath salts or related compounds, this one labeled magic plant food, which turn out to be synthetic drugs in the stimulant family. Bath salts are a new problem. The chemical compounds are synthetics, similar to the plant cat, but being synthetics, I've seen lists of over 600 different compounds that are all related. They're imported into the United States, labeled not for human consumption. Though once they're here, they're repackaged, mixed with other things, and sold under a variety of labels, bath salts, plant food, etc. Most are cathinone or related compounds. These compounds can be used orally, snorted, used intravenously, injected, and smoked. And I have seen episodes in which someone received permanent damage as a result of a single use of bath salts. Stimulants, particularly the amphetamines in pill form, are commonly used to treat ADHD. It's concerning that the number of people diagnosed with ADHD continues to rise. In some categories, we've seen a 600% increase in diagnosis. There are non-stimulant drugs that are used for treating ADHD, although they have not been widely noticed or prescribed. I've listed 3 below: Strattera, which was the first non-stimulant ADHD drug. It's now used for both children and adults. Intuniv was approved for children ages 6 to 17, and Capve is approved for ADHD in children ages 6 to 17. I suspect in the future we will see more of an effort to use non-stimulant ADHD meds, as stimulant ADHD meds can easily be abused and used for purposes other than just treating ADHD. So what's ahead for the Counselor Soapbox video channel? Some continuing videos in their drug education series, beginning with videos on individual drugs, and then later some videos about mental health and the treatment of mental illness and substance use disorder. If you've enjoyed this video, please click the like button directly below. Comments are always appreciated, and I will respond to those as quickly as I can. If you want to receive the new videos in this series, please subscribe to the Counselor Soapbox video channel. For more information, please visit the Counselorssoapbox.com blog, where you will find articles on mental health, substance abuse, and having a happy life. The David Joel Miller fiction and nonfiction books are available on Amazon.